Hey everyone. Welcome back to the channel. Today I want to talk with every adult watching about something that really affects your quality of life for the rest of your life. In my clinic, I see so many patients around the same age holding their jaw in pain. There's a number about oral health that still catches my breath every time I see it in our adult population. The percentage of people dealing with a certain hidden oral problem is close to 100%. Let me put that dry number into plain English. That means out of every 100 people you pass on the street, finding even one person with completely healthy gum tissue is extremely rare. Now, many of you might be thinking, Doc, I brush every morning and night. I don't feel any pain with hot or cold food. I feel fine. This problem can't be me, right? Don't worry, you're not alone. The vast majority of people are fooled the same way. The truth is, this so-called invisible health assassin is extremely sneaky in the early stages. It has almost no warning signs at all. By the time you notice you can't chew as well, or a few of your originally solid teeth start wobbling like leaves in the wind, and you finally come to see a doctor for help, we've often already missed the best window to intervene. Sometimes even we doctors can only shake our heads helplessly. So to make sure we can all enjoy our food without trouble for years to come, please listen carefully to what I'm about to say. Before we get into it, if you like what we share, drop a 1 in the comments. That's the warmest support for our work. And feel free to share your own insights and experiences in the comments below. This message, I especially hope those of you with older family members will forward to them. This is key knowledge to help everyone avoid a major health trap. First, let's understand the basic logic. What exactly is this frustrating oral disease we hear about so often? From my clinical experience, the most common question I hear in my exam room is, Doc, I've never liked eating sweets my whole life. On the surface, I don't even have a single black spot. So why, once I get older, do my teeth just fall out on their own? Hearing that, you might think it's strange, but please hear me out. The science behind this is exactly the blind spot that most people easily overlook. The principle is this: simple tooth decay and inflammation of the deep tissues that support your teeth are two completely different disease processes. To make it easy for everyone to understand, let's imagine your mouth as a lush orchard. Each white tooth is like a thriving fruit tree. The pink gums surrounding them and the bone tissue deep below are the rich soil that nourishes the tree. If just the trunk or a branch of the tree gets a hole chewed by a bug, that's like an ordinary cavity. We cut off the dead branch and fix the trunk, and the tree still stands tall against the wind. However, that hidden deep inflammation quietly eats away at this soil over time. Imagine if the orchard suffers constant soil loss, with the dirt slowly washing away. Even if the tree itself is strong and tall, won't it eventually get uprooted because it loses its ground? The real culprit that causes this soil loss is the tiny germs that live everywhere in our mouths. They are extremely clever every day, using the food bits left after we chew and our saliva. They quietly build a sticky film. If our daily cleaning isn't thorough enough, this film slowly hardens into a rock-hard deposit, clinging like stubborn vines in the gaps near the roots. These rough deposits become a perfect breeding ground for even more harmful germs. They set up camp there and keep releasing destructive chemicals that tear at your gums and even slowly dissolve the deep supporting bone. So this disease is essentially tiny germs slowly eating away at your bone. This is absolutely not something we can fix by drinking some herbal tea. So-called internal heat has nothing to do with it. Recognizing this is the first step to taking back control of your oral health. Now, does this destruction stay only within your mouth? If you think that, you are seriously underestimating its power. Many of you might think what I'm about to say sounds alarming, but trust me, these are real tragic lessons that happened in hospital rooms. I had a patient before who just noticed some redness and swelling in one area and didn't think much of it. Then those harmful germs traveled along the rich network of tiny blood vessels all the way into the deep tissues of the neck, eventually triggering a very dangerous condition called deep neck space infection. Please don't ignore a swollen neck like that. Once that spreading PS and extreme inflammation press inward on your windpipe and completely block your breathing, it can take a life in a very short time. I am absolutely not trying to scare anyone. This is exactly why we doctors keep patiently advising everyone that taking care of your mouth's environment, which seems like a small thing, can, in certain extreme moments, truly be a matter of life and death. And not only that, looking from a broader systems medicine perspective, this local imbalance in your mouth actually lights the fuse for whole body chronic inflammation. Modern medical research has clearly mapped out this hidden pathway. The harmful bacteria hiding deep in your gums do not stay quietly where they are. Every time you swallow a sip of water or chew a bite of food, they take the express train of your bloodstream. That's what doctors call the spread of germs into the blood. They travel through your blood vessels to all kinds of core organs and cause trouble. One of the most typical victims is the problem we know as abnormal blood sugar metabolism. These two diseases are like a bad pair of twins, each pulling on the other, creating a cycle that's very hard to break. If the inflammation in your mouth never calms down, your immune system stays on high alert and stressed out. This constant stress response makes your cells extremely slow to the hormone that lowers blood sugar, so your blood sugar levels run wild like a runaway horse. On the other side, if your blood sugar is too high for a long time, your body's ability to repair damaged tissue drops sharply. The white blood cells that are supposed to fight off invaders also become weak and useless. At that point, the rate of bone loss will be several times higher than in healthy people. So, if someone in your family takes medication for blood sugar, please take them to get a thorough check of their mouth environment. Once you put out this hidden nameless fire, you'll be pleasantly surprised to see that those stubborn metabolic numbers start to stabilize as well. Even more concerning, this inflammatory fire can spread to even deeper areas. Recent cutting-edge scientific research has found that people who suffer from long-term deep gum infections have a significantly higher risk of certain digestive system cancers. You might wonder how these two completely unrelated parts of the body could be connected. The truth is, when pathologists analyzed tumor tissue from the intestines, they actually caught traces of specific bacteria that normally only live in the mouth. This is solid proof that these clever germs can cross organ barriers and cause trouble in different places. Take the example of patients with immune system problems who suffer from swollen, painful joints. The way their immune system mistakenly attacks their own body is almost exactly the same as the microscopic process happening in the gums. And not only that, even the memory loss and cognitive decline that we middle-aged and older folks fear the most are connected to this small source. Every time we chew food with effort, we're actually giving our brain a blood massage, promoting circulation in the head. Once our teeth aren't working well, the number of times we chew drops sharply, the blood and nourishment our brain receives drops, and the aging speed of our nerve cells naturally speeds up. At the same time, the harmful chemical signals produced in the inflamed areas can even cross the last barrier protecting the brain and directly disturb our precious brain nerves. So, my friends, hearing all this, I hope you fully understand that we go through all this trouble to guard this front line, not just so we can enjoy a crisp apple in the future, but to build a strong wall against cancer, memory decline, and various chronic metabolic breakdowns for the long second half of our lives. Guard this gate, and our bodies will have true resilience. In my clinic, many anxious patients ask me, "Do quiz, take a look at my teeth. How many more years can they last for eating?" To figure out whether the foundation of this building called your mouth is solid, we have a very precise measuring stick in clinical practice. It's called periodontal probing. What exactly is that? Let's think of your tooth as a tree, and the gum as the soil surrounding the root. Where they meet, it's not sealed tight. There's a natural tiny gap in a completely healthy state. This gap is very shallow, usually no more than 3 millimeters. Daily brushing and flossing can easily keep it clean. However, the principle here is that if your oral hygiene isn't good, disease-causing bacteria set up camp there, triggering your immune system to fight back, causing local swelling. That tiny gap then keeps getting deeper. From my clinical experience, if the measurement falls between 3 and 5 millimeters, that's defined medically as mild gum disease. At this stage, the damage is still only in the shallow soft tissue. The bone that holds your teeth hasn't been affected yet. Your main feeling might just be seeing pink foam when you spit after brushing, or a feeling of fullness in your gums. But if you leave it alone and the number passes 5 millimeters or even gets close to 7, you've entered the deep zone of moderate disease. Now, the toxins released by the bacteria are actively eating away at the bone underneath. The load-bearing wall for your tooth is quietly crumbling. You'll clearly notice you can't chew slightly harder foods as well, or you always feel like a certain tooth is floating, not solid. If the measurement goes above 7 millimeters, that's extremely dangerous, severe late-stage disease. This means the bone surrounding the root has collapsed over a large area. The tooth is like a lonely tree with no soil protection, ready to tip over in the wind at any moment, shift out of place. or just fall out on its own one day while you're eating. Hearing that might make you feel scared, but please listen to me. Learning these numbers early is exactly the key first step to winning the battle for your mouth. Do we have to go to the hospital every time to find out how we're doing? Not really. In our daily lives, we can absolutely do a self-check using a few clues. The first thing to pay attention to is bad breath. Notice this is not the simple smell of leftover food like after eating garlic. This is a disgusting, rotting smell. In my clinic, I often have patients complain that they've gotten used to covering their mouth when out, and their breath smells like sewer water or rotten eggs. That's actually the bacteria hiding deep in those pockets, breaking down dead skin cells and food bits, releasing sulfur gases. This is definitely a red alert from your body. Next is annoying bleeding. Many people think it's because their toothbrush bristles are too hard or they're brushing too hard. Don't worry, you're not alone. But the truth is, healthy, strong gum tissue can absolutely handle normal friction. If it bleeds at the slightest touch, it means the tiny blood vessels there are swollen and extremely fragile from fighting off the invaders. A gentle touch makes them break. Third, do you suddenly feel like your teeth have gotten longer? That's not a second round of growth. The harsh truth behind it is that the soft tissue covering them is slowly losing ground, exposing the yellow root that should be buried deep. This is solid proof that the bone underneath is quietly disappearing. And finally, the gaps between your teeth that used to be tight are getting wider and wider. You might wonder, how come I used to eat big pieces of meat without any problem? But now after every meal, I need a toothpick for half the day, and when I talk to people, air leaks out or I spray a little saliva. These small changes are all telling you that without solid support, your teeth have started to wander around your mouth on their own. Here, I have to use my most serious tone to sound an alarm for one specific group. Those of you who have been smoking for a long time, according to a lot of clinical data, you are actually the most at risk and most easily fooled by this disease. You might wonder, doesn't smoking just turn your teeth yellow? How does that relate to gum disease? The medical principle here is that the harmful chemicals produced when tobacco burns force your small blood vessels throughout your body to clamp down hard. For a normal person, once bacteria infect an area, the local tissue immediately becomes red and bleeds, using bright red blood to alert you that something is wrong. But for those who smoke for years, because their tiny blood vessels are always tight and closed, even if the deep area is inflamed and full of pus, the surface still looks pale and never bleeds. In my clinic, I've lost count of how many longtime smokers proudly bragged that their teeth were rock solid and never bled. Then we took an x-ray and the bone underneath had already been eaten full of holes by bacteria. This false calm surface often delays the most valuable window for treatment. So, friends who smoke, please don't be fooled by this fake piece. Getting regular imaging checks from a professional doctor is the smart, responsible thing to do for yourself. So, since this disease is so dangerous, does modern medicine have a magic cure that completely wipes it out? Before we talk about treatment, we first need to understand and accept a harsh but true biological fact. Bone loss caused by bacteria is, in most normal cases, not reversible. It's like a building's foundation completely washed away by a flood. You can't expect the sand and mud to just flow back where they were. Hearing that might make you feel discouraged, but listen to me. The core strategy of clinical medicine is not to wish for the damaged area to magically go back to being perfect like a child's. Instead, we want to build a strong dam to completely stop the disease from spreading further, hold on to the healthy tissue we still have, and let your teeth live out your life with you peacefully. If, after an evaluation, you're only in the early stage, meaning only the surface tissue is red, swollen, and bleeding, then I truly congratulate you, because within this extremely important golden window, everything has a chance to fully heal. In my clinic, these patients only need one thorough, complete professional cleaning to break up and remove the hardened deposits sticking to the tooth surfaces. After you go home, as long as you carefully follow the science-based brushing method every day, the principle is that once you cut off the bacteria's food supply, your body's powerful self-repair system kicks in quickly, often within 3 days. You'll be pleasantly surprised to see that the red, puffy gums have returned to a firm pink color, and there's no more blood when you brush. However, if you've unfortunately already fallen into the middle or late stage, then hoping to fix the problem with just a regular cleaning is like scratching an itch through your shoe. A regular cleaning tool only has a certain working length. It simply cannot reach down to clean out those stubborn enemies several millimeters deep. For those stubborn deposits buried 5 millimeters or even 7 millimeters deep, we need to use a deeper cleaning method here. I need to explain a very common and effective clinical treatment system. Within our current healthcare system, as long as you meet certain criteria, many of these deep treatments can be partially covered by insurance. The most important step is deep scaling and root planing. I know the word planing sounds scary, don't be afraid. The whole process is done with good local anesthesia. You'll barely feel any pain. The doctor takes very fine instruments and goes into that deep pocket, scraping off the hard deposits and diseased tissue stuck to the root surface, just like cleaning barnacles off a boat hull. The principle is that only when the root surface is polished, smooth, and clean again can healthy gum cells reattach to it, hugging the tooth tightly. Of course, if the disease in certain hidden corners is so deep that even the finest instruments can't reach, we might need to use a procedure called flap surgery. It sounds like major work in your mouth, but it's actually a small procedure. Through tiny cuts, we gently lift the gum so that the hidden bone and root are completely visible to the doctor, allowing for precise cleaning with no blind spots. Trust me, short-term discomfort buys you long-term peace. In this difficult battle, if you still hope to get some degree of regrowth of the damaged bone, then you might need to consider more advanced tissue regeneration technology. This usually involves placing artificial bone material into the damaged area and covering it with a special membrane. You can think of it as adding good soil to a dry riverbed, then covering it with a tarp to let new bone cells grow slowly. However, these advanced methods often cost a significant amount extra. And the final depends a lot on your own body's healing ability and how well you maintain it afterwards. Also, many of you often ask me, Doc, I heard laser treatment for this disease is popular now. Can you just zap it and be done? It's true that many clinics are bringing in these light-based tools. The principle is that specific wavelengths of light can effectively destroy bacteria cell walls while also stimulating blood flow in tiny vessels. It helps with faster healing and reducing deep infection. But we have to face a core fact. No high-tech light device can currently replace the basic step of the doctor manually scraping off hard deposits. If you're extremely sensitive to pain or you want the recovery time to be as short as possible, it's definitely a great extra option, but it's not a miracle cure and it's not a must-have. You can comfortably make the choice that's best for you based on your budget and your doctor's professional advice. Remember, keeping the initiative of your health in your own hands is the best way to take care of yourself. In my clinic, I often see patients suffering terribly from dental problems. They often pull out their phones with all kinds of videos and ask me, Doc, online it says this home remedy works great, can I try it? Honestly, I really understand the anxious feeling of wanting to get better quickly, even trying anything. Don't worry, you're definitely not alone in that confusion, but medicine is a serious science behind many seemingly amazing online claims. There's often a lack of solid evidence. To help you avoid wasting money on the wrong things or even missing the best window for treatment, let's thoroughly take apart some of the most common misleading pseudoscience from a professional medical perspective. First, we need to understand that recognizing these myths is the first step toward real healing. First myth, will swishing coconut oil in your mouth every morning actually pull out the harmful bacteria from your mouth? Many people think natural oils can kill bacteria and reduce inflammation, but based on my clinical experience, this idea currently does not have solid scientific support from authoritative dental groups. The reason is that the main cause of gum inflammation, which is plaque, is actually a very stubborn film of bacteria. Think of it like the thick, sticky grease buildup in your kitchen exhaust hood after years of cooking. Just soaking or rinsing it with water or oil won't do anything. You have to scrape it hard with a brush to get it off. So don't put your hopes on oil pulling. Sticking to physical friction to remove bacteria is the real way. Next, some people like to follow habits from older generations, thinking that rinsing with very salty water will completely kill the infection. It's true that salt water has a mild effect on some bacteria and might make your sore, swollen gums feel a little better. But you need to know that the hard deposits and bacteria hidden deep in your gums are like enemies hiding in a bunker. Plain salt water cannot get through their defenses to dissolve them. We can use it as a small helper for daily maintenance, but absolutely treat it as a life-saving cure. The next one is the question I hear most often in my clinic. Doc, I spent good money on a high-tech water flosser. Every time I use it, I see bits of food in the sink and it feels great. Now I don't need to use those annoying strings anymore, right? Hearing that, you might think that high pressure water stream is really powerful, but let me tell you, this is actually the biggest blind spot in cleaning. Let's look at one fact. No matter how strong the water stream is, your tooth surface will still have a slippery film on it. The principle is that the glue secreted by bacteria is extremely sticky. They are like moss growing on rocks by a river. No matter how fast the river flows, the moss stays put. Only scraping hard with a metal blade will remove it. The same principle applies here. Even if a water flosser can flush out big pieces of meat stuck between your teeth, it cannot remove the tiny, extremely sticky colonies of bacteria. In our home care system, the only thing that acts like that metal blade is the string and special small brushes that you have to operate with your hands. Yes, a water flosser can be a helpful rinse, especially for those who have had dental work and now have wider gaps. But it is absolutely an excuse to skip physical cleaning altogether. We must learn the most scientific cleaning steps to truly hold the initiative of our health. So, how exactly do we completely get rid of these annoying bacteria? You might wonder why your teeth still get loose even though you brush on time every day. The real battle that decide your oral health is not on the smooth surfaces you can easily see. It's in those hidden gaps between your teeth. In my patient population, over 80% of deep infections start in those tight spaces where two teeth touch because there's little airflow. That place is a perfect breeding ground for bacteria that hate oxygen. So, the first prescription I give to every patient who walks into my clinic is to completely change your long-term habits. First, we need to master the scientific vibrating cleaning method. Many people, to save time, just saw back and forth across their teeth. This rough method not only doesn't remove dirt, but actually wears deep grooves into your tooth roots. The right way is to hold the bristles at a precise 45-degree angle to your gum line, like you're gently massaging the little gutter at the border. Work on two teeth at a time with small vibrations right in place. Only then can you shake out the troublemakers hiding deep in the groove. Second, every single night you must do a thorough cleaning between the teeth. Don't think that just snapping a piece of string in and out is enough. You need to use your fingers to guide it into a nice curve, giving your tooth a big hug so it fits tightly against the curved side. Then scrape from below upward. Each gap has two sides and you can't be lazy on either one. For those of us over 50, slowly entering middle and older age, this next point is extremely important. As time goes by or from early damage, you might look in the mirror and see ugly dark triangle gaps where your teeth used to touch tightly. Once this change in shape happens, a simple piece of string is no longer enough. The reason is that the smooth side of the tooth has receded back, revealing a curved dent in the root. The string will float right over that dip and never touch the dirt hiding at the bottom. At that point, we must use a small cylindrical brush specially designed for wider gaps. There are many sizes of these tools on the market, from very fine to thick. The secret to choosing the right one is that when you push it into the gap, the bristles should just fill the space completely, but the metal wire in the middle should never rub against the hard enamel surface. When you use it, just let the bristles gently move back and forth along the two sides. If you feel too much resistance, never force it, back it out and go down a size to reach a 360-degree standard of cleanliness. I usually suggest pushing the brush from the cheek side several times, then doing it from the tongue side in the opposite direction. This attack from both sides ensures that even the sneakiest germs have no place to hide, letting our chewing organs feel fresh again. As for lifestyle habits, if you walk into my clinic smelling like smoke and you have serious gum infection, then I have to give you a serious piece of advice today. Even the best ancient doctor would have a hard time saving tissue poisoned by nicotine for years. The harmful chemicals in cigarettes seriously slow down your immune system, causing tiny blood vessels to clamp down and make every repair and healing process extremely slow. If you want to keep your chewing function, putting out that cigarette completely is a necessary step. Also, regarding what you eat, some people worry that too many sweets will slow down healing. It's true that high blood sugar levels can cause your whole body to slip into a low-grade chronic inflammation that's hard to notice. That is bad for tissue repair. However, simply avoiding sweets cannot directly kill the bacteria that are already living there. Only cleaning out the local mess is the real cure. Hearing all this, many of you might feel anxious and regretful about your gums that have already receded away. You might feel unsafe. I'm very sorry to tell you that those soft tissues that have pulled back will not grow back on their own unless you have very advanced surgery. All the hard work we put in every day is ultimately in order to build a line of defense to stop things from getting worse. This time-consuming, energy-draining disease is in essence like high blood pressure or diabetes. It's a chronic problem that needs management for life. You definitely cannot to depend on swallowing a few antibiotic pills and be done forever. Instead, you need to form a lifelong alliance with a trusted professional doctor. Getting a deep professional cleaning every 6 months is not only responsible for your own body, but also the most direct and effective last line of defense to stop the disease from getting worse. I know I've been direct, even strict today, but deep down, I truly hope you can avoid unnecessary detours. Don't wait until all your teeth are wobbling to feel regret. You need to know that in the future, if you need dental implants or full mouth reconstruction, that's a huge expense of thousands of dollars. Compared to that, investing a few cents a day in small cleaning tools, smart people can easily figure out which makes more sense for your health. My friends, time has flown by as we've talked from the heart. We've gone from that hidden, deadly oral health assassin to how it quietly eats away our jawbone. From its connections to high blood sugar, tumors, and even memory loss to the scary depths of gum probing. From the red alerts of bleeding gums and bad breath to how smoking cruelly hides the truth, and finally, to how we use deep cleaning and between teeth hygiene to win this battle, every single one of these topics is a big deal for whether we can enjoy our food and sleep peacefully in the second half of our lives. I've put in a lot of effort today to help us break the deadly myth that tooth pain isn't a real illness or that losing teeth is natural when you get old. Teeth are not just wooden posts stuck in flesh. They have blood, life, and deep roots in the soil. We cannot just stare at the white surface and ignore the ground that is washing away underneath. Only when we understand this small world and take care of it with scientific physical cleaning will our teeth give us the longest companionship and the healthiest body. The health in our lives often does not depend on how many thousands you spend on fake teeth in the future. It lies hidden in those few minutes of brushing and flossing each morning and night. Today, by understanding this knowledge and realizing the vicious cycle between local inflammation and whole body health, you might just save a wobbly real tooth or even help a family member with diabetes stabilize their out of control blood sugar. That is real wellness, small investment, big return right now. I strongly suggest you don't hesitate. Go to your bathroom sink, open the drawer, and take a good look. Is your floss ready? Did you buy the right size brush for those dark triangle gaps? Is that old toothbrush with bent bristles that should have retired long ago ready to be thrown out without mercy? If you feel that these honest words today have touched you, made you break out in a cold sweat, but also see things clearly, I kindly ask you to use your hands to give this video a big like. Every one of your likes not only encourages me the most, but also helps the system push this video, which might help someone save their teeth, to more friends who have been fooled by misleading information. I also really hope you will share this video in your family group chat with your spouse, your children, especially those older relatives who have smoked for years and think their teeth are fine, or those whose blood sugar is always unstable. Give them a reminder. Let them also see the true face of this hidden killer in the mouth. Your one simple share passes on priceless health confidence and deep care for your whole family. Finally, welcome to leave a comment below. Do your gums still bleed when you brush? Have you ever had your gum pocket depths measured, or do you have any special tips for choosing and using small cleaning tools? I really look forward to seeing everyone's stories in the comments. I will read every single one. Let's keep the conversation going and make our mouth care more scientific and more thorough. I wish every friend watching this strong roots, a healthy body, and the joy of eating whatever you want, even biting into a crisp apple when you're older. I'll see you in the next video. Take care. This is for educational purposes only. Always consult your own doctor before making changes. If you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science, not replace professional medical advice.